Dr. David Krohse here again, and I want to share with you the dangers of out-of-network care to your finances. And so I'm going to tell you a story, the worst story that I've heard about this. I talked with this lady face to face, and she had a great insurance. She worked for a local school system, and her care essentially covered almost everything. It was pretty close to 100% covered. But she found out she was pregnant, and she found out that her baby was likely to have some special needs issues. And so her OBGYN recommended that they do some extra lab work. And of course, given that recommendation, she said, okay, let's find out exactly what's going on. Went and had the lab work done. Well, it turned out that the lab was out of network with her insurance. And ultimately, the bill ended up being $2,500. So not only did this family find out that they were going to be dealing with a special needs child and the stresses that would go with that, but now they were 100% on the hook for $2,500. And this is with having a good insurance. And so the specific insurance they had, it was a well-marked Blue Cross and Blue Shield, which is the top insurer in Iowa. But they had what's called an HMO plan. And so you know, an HMO plan, that stands for Health Maintenance Organization. But HMO plans, they cost you or your employer less money, but the savings happen because they have a smaller network of providers. And so if you have an HMO plan, that's a special situation where you have to make sure and ask the question, anywhere along the way, you have to say, is this service or is this provider considered in network with this HMO plan? So that would be lab work. That would be if you get referred out for an MRI. If you have anything done, you need to be asked questions about that. And even worse, you can go into the hospital, and the hospital overall could potentially be in network with your HMO plan, but there could be special providers that come and work with you that are out of network, and a person could get a separate bill from one of those providers. So that's the thing, is that you have to ask these questions. Is this person in network or out of network? And again, any kind of special testing, especially, even if the person that referred you is in network, you have to take control of your healthcare, and you have healthcare, and you have to ask questions and say, is this in network? Is it out of network? And if it's out of network, then you have to ask questions about what it's going to cost if you don't want to get surprised by a bill. Because if we jump back to that family's situation, $2,500, Wellmark, they kind of just raise their hands and they say, you went to an out-of-network provider. We don't have any benefits with them, and so you're on the hook for it. The OBGYN, they kind of raise their hands and would say, we didn't know that they were out of network, so it's not our fault. And then the lab work, they did the procedure. And so, at the end of the day, you don't want to get surprised. You have to ask questions, and you need to be asking every step of the way. If you get referred out anywhere, are you in network? Otherwise, if you get surprised, it is on you, and you're probably responsible for any charges that get incurred.